This morning, we continue our CBC News analysis of federal data looking at Canada's temporary foreign worker program. The focus today, the impact of that program on the healthcare system, which of course faces persistent staffing shortages, notably after the pandemic. Healthcare facilities are turning to temporary foreign workers to bolster their ranks. Once again, let's head live to Calgary and reporter Kyle Bax, who's been looking through the data. What have you learned, Kyle, in terms of the positions that are in demand and are being filled using the temporary foreign worker program?
Yeah, we're talking about positions across the board, not just registered nurses and doctors, but even technicians and nurse practitioners. And, most of these hires are happening in Quebec, but it's a trend that we're seeing across the country. And if we take a look at the overall numbers, it kind of paints a pretty good picture. You can see how back in 2018, employers were approved to hire around 450 healthcare workers through the temporary foreign worker program. Last year, those approvals rose to more than 4,000. And those in the industry point to various different reasons for why they're turning to this program, talking about how we have this aging population, so fewer people are entering the field. And of course, they talk about the pandemic, where a lot of these healthcare workers felt burned out. They were working long hours in hospitals, healthcare clinics, care homes, and so on. We spoke with one employer in particular that runs a network of clinics, and they talk about how they've now hired 9 doctors through this temporary foreign worker program, and here's why.
Obviously, we would love if there were more family physicians with permanent residency or citizen status readily available to fill the vacancies that we have right now and provide the much needed primary care to the rest of the Canadians. But unfortunately, it's not the case. The demand that we're seeing from patients for access to a family doctor currently far outweighs our supply of physicians that we have that have the capacity to take on additional patients.
And it's not just private companies that are turning to the temporary foreign worker program, but provincial healthcare agencies as well, including Alberta Health Services as an example. That provincial health agency was approved to hire about 150 nurses and doctors. And a spokesperson for the agency says it's just one of their many different avenues that they look to hire locally and internationally to fill positions.
So as they've looked in this bit of a stopgap way, Kyle, to address shortages, what is the long-term plan and what are the long-term solutions?
Well, some point to how employers need to just spend a lot more time on retaining the workers that they have. Some also point to how there needs to be higher wages and try to train more healthcare professionals within the country. But it's a really difficult situation, and it really speaks to the problem that's happening in the country right now. And some experts say, there's no easy solution to this. Have a listen to one expert and what they had to say.
I think this is another example of the overall healthcare workforce crisis. We see high levels of workload, high levels of burnout, high levels of attrition. And if you can imagine that, that's a vicious circle. And we have to interrupt that in some way, shape, or form.
And right now, the federal government is tightening up the temporary foreign worker program, but there are 2 exemptions for 2 different sectors, construction and the healthcare sector. And the government says that's just because those 2 sectors are facing the most acute labor shortages right now.